Good evening. Good evening, ma'am. Good evening. Okay, I will start. I think the others will join. Okay. Okay. So the course name is Specialized Course in Therapeutic Applications, especially for women health. We will be discussing in this course about thyroid, PCOD, PCOS, menstrual disorders, menopause, and some additional topics also. Uh, and it is planned as 4 weeks course, and we will be having classes 5 days in a week, Monday to Friday. And if the topics are not covered within 4 weeks, we will take 1 or 2 weeks again. And you will get a certificate which is from Atmaya Yoga, which is accredited with the Yoga Alliance and also Indian Yoga Association. Okay, so in the first week, we will be discussing the introduction, what is yoga therapy, what is endocrine system. The general introduction will be there in the first week. So day 1 to day 20, I will be discussing what all will be covering. Day 1, we will be covering the introduction to yoga therapy. What is yoga therapy? Difference between general yoga and yoga therapy. And we'll be understanding some new concepts like Adija Vyadi, Anadija Vyadi. We'll be discussing about that. And a little bit of practical Sukshma Vyayama, then how to send a body awareness practice. These are the practical side of introduction. Then day 2, we will be discussing the anatomy and physiology of endocrine system. Any idea what is endocrine system?
Which covers all the glands in the body, secretion of.
Secretion of glands.
Secretes hormones. So we'll be discussing the anatomy and the physiology of endocrine system. We will not be discussing the whole human anatomy. Only endocrine system we will be discussing. And mainly we will be discussing the glands which is associated with this thyroid, PCOD, PCOS, menstruation. Okay. And in this we will be discussing about thyroid gland, pituitary gland, adrenal gland, and the hormonal feedback loop biomechanisms. All these we will be discussing. And in the practical side, we will be seeing the asanas and pranayama, which can stimulate the endocrine system. Okay. Then in the day 3, a little bit of yoga philosophy, pranic anatomy, chakras, and how it is associated with the endocrine system, and the meditation and pranayama associated with this pranic anatomy we will be discussing, and the connection of chakras with the endocrine system hormones. Then the day 4, we will be discussing stress and emotions, and the hormonal imbalance associated with the stress and emotions, and the role of stress in all the conditions like a thyroid, PCOS, menstruation, menopause. In all those conditions, how stress is affected. This is an additional topic which is related with this women health. And in the practical side, we'll be seeing the restorative asanas, which can reduce the stress management. The practical we will be learning, and yoga nidra practice. Then how it is helping the hormonal balance. Then the day 5, end of the week 1, we will be learning diet and the lifestyle of daily routine for hormonal health. Then the Ayurveda concept, Ahara Vihara principles, then some modern nutrition for hormonal health. These all we will be discussing. And again, some gentle flow of asanas we will be learning in the day 5. So first week over with the introduction, general introduction of hormonal health, hormonal imbalance, then women health, etc. Okay. In the second week, first we will be learning about thyroid physiology and function of the thyroid gland, which all hormones are secreted by thyroid gland, and how it is take part in the metabolism, how the metabolism is controlled, and we will be learning in the practical side the preparatory asanas for thyroid health, then Ujjayi breathing, which is associated with this thyroid gland. We will be learning as a practical. Then the next day we will be learning hypothyroidism, then pathophysiology, then yogic approach, then causes of this hypothyroidism symptoms, and the correction, yogic correction for that metabolism activation we will be learning, and the asanas related to it. And the day 8, after that we will be learning hyperthyroidism and the yogic approach, then symptoms, then the other symptoms associated with the hyperthyroidism like anxiety, then restlessness, then weight gain, weight loss. These all are associated with this hyper and hypothyroidism. Everything we will be discussing pathophysiology, the metabolism, biochemical cycles. If you are interested more in science part, we'll be learning more about it and the asanas associated with it. Then the next day we'll be learning the role of pranayama in thyroid. How pranayama can improve the metabolism, how it can activate the thyroid. We'll be learning more detail. Then in the day, like the last day of the second week, we will be learning how to design the therapeutic class for thyroid cases, and some case studies we will be learning, some contraindications, then modification, how to modify these all, how to plan the class, how to have that template. All these we will be learning in the last day of second week. Then coming to third week, we'll be starting with the female reproductive system, and the general anatomy we will be learning, and the menstruation cycle we will be learning, and PCOD, PCOS, menstrual disorders, menopause. All these conditions are associated with the female reproductive system. So we are starting the third week with the reproductive anatomy. Then we'll understand menstruation first, then menstrual disorders, then upcoming days we will be learning PCOD, PCOS. Everything is associated with the female reproductive system and the endocrine system, which is by which hormones these disorders are happening, then which all hormones are imbalanced, then about insulin resistance, then emotion aspects, modern view and yogic view, pathophysiology, everything we will be learning. And all the yogic practice will be associated with the pelvic anatomy. Okay. Then after that, we'll be learning chakras associated with the female reproductive system. Swadhisthana chakra and Vayus associated with the female reproductive system. The role of pelvic energy, then prana imbalance, emotional healing. All these we will be learning in this third week. Then yoga therapy, therapeutic view of menstrual irregularities, then types of irregularities, dysmenorrhea, amenorrhea, so many terms are there. Everything we will be learning. Then asanas associated with it. Then some kind of detox topics we will be taking. Then metabolic regulation, then role of Shatkriyas. So which all Shatkriyas we can take in this female reproductive health. All these we will be if you want that demonstration, we can take one session. Otherwise, we will be explaining in this theory. And in the end day of third week, we'll be discussing some case studies also. And we will plan class design and some real life examples, and how to teach in group, how to take personal classes, everything we will be learning. And the last week, we will be discussing menopause. Understand the menopause, hormonal changes in the menopause, physiology of menopause, the hormonal role, estrogen, then symptoms and stages of menopause, everything in the scientific way we will be learning. And the asana pranayama associated with it we will be learning. The next day we will be learning yogic management of common symptoms which are present in the menopause stage. Then the next day mental and emotional well-being, physiological transition, then mindfulness, acceptance, all these concepts we will be discussing. And the next day we'll be learning some Ayurveda topics, diet and lifestyle relate, which can apply. Then Ayurvedic doshas during menopause, which all herbs we can use. Then about food and sleep, lifestyle changes, routines, all those we'll be learning. And if time allows, we'll be discussing about fibroids and infertility. And after that, again, if you need some additional topics related to that, you can just mention, we will be learning about it. So this is the course syllabus. Any doubt in the syllabus?
Oh, ma'am.
Okay. So we'll do one thing. We'll start the introduction. What is therapy? What is yoga therapy? Any idea?
Therapy means particular condition. We are working on particular condition. So according to that, we are giving the solution.
Hmm. It's correct only.
In general, I have said them.
Yes, it's correct.
Yeah.
And any other answer?
Regarding therapy?
What is therapy? What is yoga therapy?
You should set the system right. जहाँ भी कोई problem है, so therapy can be in any form, like in in the form of medication or in the form of taking rest. कोई भी situation जिससे जिससे body हम fit रख सके उसको हम therapy बोलते हैं. It can be meditative session, it can be medicinal practice or anything like that.
So yoga therapy is actually we are applying some specialized or customized yogic tools. That may be asana, that may be breath work, that may be relaxation, maybe meditation, mantra, or any kind of yoga philosophy principle, lifestyle principle, anything if we are designing to apply for a particular condition to relieve or elevate some health challenges, that may be any kind of health challenges, we are applying these tools to promote healing. Okay, and we are restoring the holistic balance in that body mind system. This is called yoga therapy. In the general yoga, what we are doing, overall fitness, overall wellness, that may be for flexibility, that may be for stress reduction. Overall wellness, we are doing generally yoga sessions. But in yoga therapy, we are therapeutically more tailored yoga practices we are adding. Okay, to meet that physical, mental, emotional needs, whatever they are, the individual need to heal. We are applying all aspects of tools in such condition. That is called yoga therapy. And what are the purpose and the scope of yoga therapy? Actually, so many purposes are there for yoga therapy. If we don't understand it particularly or properly, if we don't understand, we cannot apply it for that needed individual. So the first and the main scope is for addressing specific physical, mental, or emotional disorders. Okay. Physical, mental, emotional disorders, in the sense, everything is coming under it. Okay. Which all symptoms associated with the musculoskeletal issues. Musculoskeletal issues, which all include the back pain, neck pain, then arthritis, posture imbalance, which all associated with joint immobility. These are collectively called the musculoskeletal issues. So yoga will help. Yoga therapy will help.
Slow.
I will give notes.
Slow.
Don't worry. I will give notes.
वो लिख रही है मैं लिख ही नहीं रही मैं तो इंट्रोडक्टरी
Musculoskeletal.
चाहिए ना पूरा. हाँ, अभी आर्थराइटिस, नेक, बैक पेन वहीं तक.
No, skeletal muscles जो are born.
Skeleton muscle.
अभी तो मंडे से क्लास स्टार्ट है तब नोट्स बनाइए
नोट्स रखी तो लिखना चाहिए।
हाँ, नोट्स जितना लिख सकते हो उतना लिखो। ओके, तो मस्कुलोस्केलेटल कलेक्टिवली जो मसल्स में और स्केलेटल में जो होते हैं, तो बैक पेन है, नेक पेन है, जो भी एसोसिएटेड विद और स्पाइन, lumbar, then cervical, then joint immobility, then arthritis. All these condition is called musculoskeletal issues. So generally people come to yoga to relieve all these back pain, neck pain, जो भी pain है वो relieve करने के लिए बहुत सारे लोग आते हैं. Okay, but actually we have to take that cases into these therapeutic conditions. Okay, so we are now discussing the scope and purpose of yoga therapy. Then respiratory problems. Another system of a human body is um, respiratory system. So बहुत सारे issues होते हैं respiratory, asthma,
Asthma,
chronic pulmonary disease, then any other kind of बहुत सारे sinusitis. तो बहुत सारे respiratory problems solve करने के लिए भी yoga therapy is useful. Then another system of human body is digestive system. जो भी digestive issues है, if we apply yogic tools properly, we can relieve so many bloating, acidity, irritable bowel syndrome, so many digestive issue, constipation, so all these indigestion.
acid reflections बहुत रहता है अपने को।
So this is associated with the digestive system, and yoga therapy we can apply. Then reproductive hormonal issues, whether that is in male or female, जो भी associated with the, if there is hormonal imbalance, it may also affect the reproductive system, because reproductive system releases hormones for so many things. So reproductive imbalance, if anything is there, like the PCOS, menstruation, menopause, infertility, so many things we can alleviate by the application of yoga therapy. Then mental health concerns, which is associated with the nervous system, like anxiety, depression, stress, insomnia, sleep disorders, so many things. So collectively we can call it as yoga therapy can apply for physical, mental and emotional disorders. Okay. Then another scope of yoga therapy is to support medical treatment and improve quality of life. So yoga therapy or yoga will be complementing. Okay, complementing. It is not a replacement of medical care. Those already are in the chronic illnesses like hypertension, cancer recovery, autoimmune conditions. So in such condition, they definitely need a medical care. But in addition to that, we can apply yogic therapy to complement their recovery. And also post-surgery cases, post-illness recovery, like example in COVID recovery, then post-surgery. Okay, in such conditions, we can bring them back by gentle movement. If they are lacking their mobility after such conditions, we can give that therapy sessions by gentle movement, then some breath awareness, then some mindful relaxation. So this will complement to accelerate the healing process. Okay, so we are, as yoga therapist, we are giving or regulating the parasympathetic nervous system, and it will support that physiological functioning also. If we are working on the parasympathetic, it will definitely support the physiological functioning also. And it will help heal very soon. This is another scope. Then also, yoga therapy will be helping to restore homeostasis. Homeostasis matlab the balance of the body systems. Human body is having so many systems, right? Nervous system, endocrine system, immune system, digestive system, respiratory system, nervous system, musculoskeletal. So every system should be in a balanced condition, equilibrium. Every system should work properly. So that balance is called homeostasis. So if we are applying this yoga tools, homeostasis. HOMEOSTASIS. SAS, homeostasis.
Homeostasis.
Stasis.
Stasis. Okay.
So many scientific terms you will learn. बाल ऐसे हो
होम्योस्टेटिस में बॉडी
जाएगा.
टेम्परेचर मेंटेन भी होता है ना, बॉडी
हाँ,
टेम्परेचर भी मेंटेन
everything,
होता है ना homeostasis?
everything in balance. A normal healthy individual, if they are balancing their every system, then that condition, that state is called homeostasis. Okay, then every system will be in a controlled way if we are doing or applying yoga tools properly. And also, in a spiritual way, if we are speaking, yoga tools will be connecting the practitioner with the body awareness and the inner healing. Okay, so here, if the practitioner is like applying these tools, then they are definitely recognized. If there is any kind of imbalance or stress, the practitioner can become aware. Early signs will be there if they are applying, and they will be trying to listen to their body instead of fixing their problem. Okay, if they are aware of their body and mind, then they can like self inner healing will happen. Okay, these are the scope of yoga therapy. Any doubt till now?
No, ma'am.
Okay. Now coming to how it can be a systematic and personalized practice, yoga therapy. So how you can take yoga therapy clients, how you can take. First, first step is assessment. You can write if you want important points if you feel. Assessment. First, we have to understand the condition of the client. And this is the most crucial step in yoga therapy. If you are not assessing the client properly, you cannot understand the condition of the client and you will be applying any of the yoga asanas and pranayama, and recovery or healing will not be there. The first thing is assessment. So here, every aspects you have to take, not only the physical. You have to understand the physical, mental, emotional, physiological, energetic. Every aspects you have to assess. So physical condition, what all things you have to, what the factors associated with physical conditions are postural analysis, whether their posture are correct or not. Then flexibility, how flexible they are. And the flexibility is associated with the mobility also. Mobility of the joints. Then strength and stamina. Then balance. Then their breath patterns, how they are breathing. Are they breathing short or rapid or slow, mindfully or not? Then areas of pain or restricted movement. Restricted movement again, mobility, the same meaning. If they are having any kind of pain while doing, or you can verbally also you can ask these things, and a good observation also should be there. Then physiological health. The second criteria is
1 minute, ma'am. While doing pain, starting में तो pain होता है. Okay, it is common only.
There are difference. Like a stretching will be there. Restriction will be there. Okay. So they have to understand what they are feeling. Stretching is different. Restriction is different. Restriction happens when they lack mobility. So if suppose we are doing forward bend, Padahastasana, for example. Okay. Padahastasana, if they are not able to reach, something is restricted. The movement is restricted. How to explain? If you are coming to Padahasta, your body is not coming down. That means the lack of mobility in the hip joint.
No.
Hip joint. not spine, hip joint. तो hip joint मोबाइल नहीं है इसलिए forward bend नहीं हो रहा है. But mobility is there, but if they are having a pulling effect on any of the muscles, then that means stretching. So
अभी
you have to
ज्यादा लोगों को ये शोल्डर पेन और ये क्या बोलते हैं इसको, मजिल,
triceps,
बाइसेप्स,
biceps, triceps.
हाँ, यहाँ बहुत पेन रहता. अभी रोटेशन भी ज्यादा नहीं कर पाते और टेबल में इनिशियल डेज में टेबल कैटन को करवाते तो भी दे आर गेटिंग पेन, wrist pain and this biceps pain.
One thing, lack of mobility in the shoulder. Okay, so they have to focus on the shoulder mobility and also the muscles associated with the shoulder. So, see what we usually, our hands are like a downward movement, right? We are not always doing the up and down action.
Yes.
So actually they have to use their shoulder in any kind of activity. So if there is a like a lack of activity, physical activity, definitely there will be like all the muscles and the shoulder joints are idle, not doing anything, then pain will be there. And also before starting, you have to lubricate the joints also before starting the session. So if they are like a poor lubrication in the joint, then pain occurs. Okay. So this is physical condition, the assessment. Then second criteria is a physiological. Physiological means you are coming internally. The information about their digestion proper or not, their eating pattern, then sleeping pattern, then their menstrual periods, how it is working, then energy levels, whether they are like a fatigue or lethargic or highly energetic, and how about their bowel movement, then appetite. All these assessment you have to check. Matlab you have to ask verbally or you have to give any form or not. Then medical background, another important criteria, medical background. History of illnesses you have to take. What all medications they are taking, any surgeries done, how long it is being done, then any ongoing treatments are there. So medical background, another important fact. Then mental emotional state. Here how stressed they are they anxious or not, any mood fluctuations are there, then their sleep hygiene, their thought tendencies, overthinking or not. So this mental emotional state also. Sleep thing will be coming under the lifestyle factors. In the lifestyle, we have to assess their work environment, their diet, their daily routine, their habits, their relationship, then their sleep hygiene. All these are coming under the lifestyle factors. Then I mentioned the energetic assessment. How to assess the energy. So here, how we can check the energy level, we can observe the breath. Observe the breath, rhythm of the breath. Then body awareness. Are they aware of their body? Then energy flow imbalance, how we can, whether it is excess or low or intermediate, we can, by seeing one person, we can understand that how their energetic level is, their way of talking. So all these will be coming under the energetic assessment. And how we can assess their all these condition. Either you can prepare a questionnaire including everything. I will send you sample how to assessment form I will send you. Then otherwise you can ask personally by asking some questions. Okay, so but I will prefer to questionnaire because they will also don't hesitate to tell everything. But if you are asking, they may hide.
Yeah, they are hiding now. So initially, हाँ, फर्स्ट एक लड़की आई थी, उसको थायराइड था कहते. सो आई initially I will ask if you have any health problems, you can share with me. Then she said, I don't have any problems. Simply for simply for flexibility, I want to join the classes, she said. So after 2 months, first she has taken that thyroid tablets. Okay. Then after some days, she stopped to take those medicines. And अभी 3rd month से उसका फिर से थायराइड स्टार्ट हो गया होगा शायद. बहुत ब्लीडिंग हो रहा है और एनर्जी आल्सो लॉट ऑफ एनर्जी शी हैज गॉट. एनर्जी बहुत कम हो गया उसको. ओके. अभी 15 डेज में पीरियड्स आ रहा. तो ये सब मेरे से कुछ भी नहीं बोली उन्होंने. ऐसे थायराइड था, टैबलेट्स यूज किए, कुछ भी नहीं शेयर की.
So better keep like a standard questionnaire. So इसमें बहुत सारे मतलब check box questions you can add. So I will share one sample. So accordingly they will share, they will tick and or either you prepare Google form. So it will be more standard. So you will be having that data also. Then accordingly we can assess.
Yes.
Okay. So here why we need to assess, not to prescribe actually. We are not doctors. We are just like helping them to heal more easily. So here we can assess the person and understand the person to prepare the class properly. And we will be designing a personalized practice plan. Then according to that, their needs and their limitations, and according to their goal, we will be adapting the particular class plan. Okay. Then after that, after this assessment, next step is customization. In the customization, we are selecting the appropriate asanas according to the person's conditions. That may, for example, anxiety, take the condition anxiety, then we will be taking restorative practices, okay, which will be helping them to relieve that anxious condition. And another example, joint instability. If somebody is coming for yoga class by saying joint instability, so here we will be customizing as a strengthening poses. So this is what customization means. Okay, then after that we will be choosing pranayama techniques which is suitable for that person's energy. Because if somebody is like a calm nature, we cannot give more calming pranayama. If somebody is highly energetic, we cannot give Kapalpati Bastrika type of pranayama. So customization is also very important for choosing the pranayama. Then addition of relaxation and a meditation practice. That definitely we have to check the mental tendencies in order to add this relaxation and meditation practices. For example, for anxious person, for like a sleeping disorder person, how to add this meditation and relaxation, that is very important. Okay, and after this, suggesting the lifestyle and dietary modification, that is also aid the therapeutic application. If you are able to give some suggestions for their lifestyle changes, dietary modification, and if you could give some application of yoga philosophy, that is also very good. It will be helping to improve the healing more very fast, we can say. Then another thing is adjusting the intensity of the practice. So whether the practitioner may be beginner, intermediate, or advanced. So here intensity matters. You have to choose and adjust the intensity of the practice accordingly, and duration of the practice. Some may practice for 20 minutes, some may practice for 1 hour, some may more than 1 hour. So that is according to the client's need. The therapist may customize how long they would like to practice. Okay, and sequencing is also another important thing, which all conditions you are taking. So the sequence should match with their recovery, okay, and their physical capability. So those who are in like a wheelchair, you cannot sequence standing asana or seated asana. So sequencing is very important. Okay, these are the customization. Any doubt till now?
No, ma'am.
Okay, so in therapy, we are combining, like in the yoga structure, we are combining all the tools like asana, pranayama, meditation, relaxation, all levels we are integrating. Or in other way, we can say that we are healing from the Annamaya Kosha to the Anandamaya Kosha. If you are saying more like a spiritual way, from the physical Annamaya, then to the energetic level, Pranamaya, then to mental level, that is Manomaya, then we are healing the intellectual level, that is Vijnanamaya, and finally spiritual way we are healing, that is the Anandamaya. And after assessment, then customization, then comes observation. Okay, healing is a dynamic process. So here, as a yoga therapy teacher, we have to understand or observe the client's state. Every client, when they are in a consistent practice, their state changes. Okay, so if they are showing any changes, your plan also has to change accordingly. There should be continuous observation and there should be continuous feedback also. Okay, if you are collecting the feedback from the student, you can accordingly modify and tune their further classes. So it will be lead to progress, more progress will be there. So how you are observing, you have to track the client's response to each asana practice, pranayama, relaxation, how they are reacting. You have to observe. Then you can monitor the energy level, their mood changes, any symptom variations occur, you can monitor. Okay, then if there is any improvement in the discomfort, like if initially we also faced this physical strain, emotional release, or maybe body pain, fatigue, initially we faced this. So the same, if you are feeling some improvement is there from the discomfort, then that means your therapy is working. And also you have to encourage the client through their healing process, and also timely modifications you have to add. Something you can add, something you can remove, you can adjust the intensity level, and you can change the focus. Everything you can modify, and accordingly you take the feedback also. Okay, these are the steps in the yoga therapy: assessment, customization, integration of yogic tools, and observation. Dinner over?
Yes, ma'am.
That's why sleepy.
No, I'm not sleepy.
Okay. Now, what is the you tell what is the difference between general yoga and yoga therapy? A few points.
Yes, ma'am.
We
Difference
customize.
between
Hmm.
general yoga and yoga therapy.
जनरल योगा तो सभी कर सकते हैं. Everyone can do this general yoga. Coming to this therapy, particularly we are doing customization for that condition. That's it.
Correct only. Yes.
In general yoga, we consider overall the physical conditions in general, like for weight loss class or something. We take on average level class, which everybody can do. But for therapeutic, we have to make a specialized class. We should have a specialized training for that, so that we can individually handle a client based on the physical or mental, whatever you just told. Based on that, we have to specifically design a class, then try to cure that at the gross level and at the subtle level also. That's about the yoga, therapeutic yoga.
Okay. So take it as a homework. Difference between general yoga and yoga therapy.
और स्टार्ट हो गया.
Homework start.
डेमो में भी होमवर्क. मैम बड़ी स्ट्रिक्ट है. आगे क्या होने वाला है इससे विजय मैम बहुत बुरी हालत
बहुत
में.
सारे बहुत सारे होमवर्क आने वाले हैं.
अच्छा मैम, अच्छा लगता है, बहुत अच्छा लगता है. आज मैंने पहले ही वो खत्म कर दिया दिन में ही बैठ के. आज का ऐसा असाइनमेंट मुझे
असाइनमेंट.
पता था
ओके.
शाम को नया आने वाला है.
Okay. So एक
क्या
15 more
डिफरेंस?
minutes we have. One more small concept I will be taking. Okay.
Difference between the general yoga and
And
therapeutic yoga
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 therapy.
therapy.
and yoga therapy.
Mm.
Okay. Now let me know what is Vyadi. If you remember.
Obstacles.
Some
ठीक है.
वही तो कैसे
हिंदी
फ्रेम
में थोड़ा
करना
इनको प्रॉब्लम होती है.
है. हाँ,
इनको हिंदी में थोड़ी
वही
प्रॉब्लम
तो
होती है. I
Vyadi
can
in
understand.
इंग्लिश में भी आता है. हाँ?
in Yoga Sutras we learned Vyadi. What is Vyadi?
वही अभी
The
मैम ने बताया
difficulties,
ना
obstacles,
It's an
obstacle.
obstacle.
आदि व्याधियां, obstacles, difficulties on any
Yes.
path.
And what is the meaning? Disease. Disease, disorder. Okay. More definite, if we define it is a state of imbalance. Okay, if the person is having any imbalance or disturbance, then it will disturb the natural, that homeostasis will be disturbing. The natural harmony will be disturbing. That condition is called a Vyadi. Okay. But according to yoga philosophy, this is not only the physical condition, but also mental condition. It's a obstacle in the yoga path. One of the obstacles. There are so many obstacles. In that Vyadi is one of the obstacles. Okay, when the harmony disturbed means it is disturbing the all 5 sheaths. What are the 5 sheaths? Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya. So there are 2 types of Vyadis, Adija Vyadi and Anadija Vyadi. You can write if you want Adija and Adija. Adija Vyadi and Anadija Vyadi.
Anna,
Adija is a psychosomatic. Adija and Anadija.
साइको
Adi,
Anadija.
psychosomatic. Adi. हमें ऐसे बोलते हैं ना आदि. That is originating from within, particularly from your mind. And this psychosomatic or mind originated disease, this is called Adija Vyadi. And this is arises due to any kind of mental stress or emotional conflicts or any past trauma, suppressed feelings or overactivity of the mind. If these kind of situations you are going through, then this mental disturbance will create energetic and physiological imbalance. Okay, if mind is disturbed, body will disturb, and mind is disturbed, it will manifest in the physical disorders, manifest as a physical disorder. This is called mind originated disease or psychosomatic or Adija Vyadhi. So here examples, now we can say thyroid imbalance, PCOD, menstrual irregularities, hypertension, anxiety, migraine, obesity, insomnia, so many digestive disorders, so many conditions are a part of or may cause of psychosomatic disorder. Then second type of vyadi is anadija vyadi, that is occurring externally. Externally originated physical diseases. Anadi means which is not from the mind. It is purely physical order. That may be caused by external factors like bacterial infections, injuries, toxins, accidents. These are called anadija vyadi. Examples: fractures, wound, then environmental poisoning, then viral. All these are anadija vyadi. Okay. So how we can apply yogic tool in such cases? So, according to Patanjali Maharshi, Vyadhi is one of the primary obstacle in the progress of a yogic path, in the yogic path, or it is a distraction of the mind, which can cause imbalance. So, when we are applying yoga energetically and physiologically, we can remove this fluctuation, obstacle. When the mind is disturbed, it will affect heart rate, breath pattern, then eating pattern. So, which sheath is disturbed? When mind is disturbed, which sheath, which layer of the body is
Manomaya.
disturbed?
Manomaya
Manomaya,
kosha.
mental sheath. Mental sheath is disturbed. So, when the mental sheath is disturbed, thoughts and emotions will become restless. So many mental conflicts may create, then it will be affecting the nervous system. If nervous system is affected, it will disturb the parasympathetic nervous system. Okay, then if Manomaya Kosha is disturbed, it will create an energetic flow also disturbed, then imbalance in the Pranamaya Kosha also happen. Pranamaya Kosha is the energy sheet. So breath becomes shallow, maybe uneven, restricted breath will be there. Some may like a suffocation, some may feel suffocation. Then that energy is disturbed. If energy here in yogic philosophy, we say it as prana. If prana flow is disturbed, the nadis become blocked. Then there will not be a free flow of the prana. Okay, if the nadis are blocked, then vayus. The vayus like apana, samana, udhana, every type of vayus are also disturbed. Okay, so from the mind, outer sheath, pranamaya is disturbed. If pranamaya is disturbed, manifested in the annamaya kosha, physical body. So as a result, hormonal imbalance, metabolic imbalance, chronic tension, fatigue, digestive problem, sleep pattern problem, everything. And over time, it will lead to major disorders. Okay, this is the yogic view of the Adi. Okay, understood?
Yes, ma'am.
Every problem, there is a root cause is stress.
Stress.
Mostly stress is the main problem.
So here how we can apply the yogic rule. We can calming the mind. Manomaya kosha में काम करना चाहिए. So here Manomaya kosha, first we have to do some stretches, then practices like pranayama, yoga nidra, meditation, mantra chanting. So all these will be calming the mind. Okay, then the state of Sakshi Bhava we have to cultivate. If there is a Sakshi Bhava, what is Sakshi Bhava?
Yes, ma'am. Sakshi Bhava.
Sakshi Bhava.
Means
भूल गए.
एक opinion like promising जैसा I just translate कर रही.
Manomaya kosha
दिमाग
means
दिमाग
when you do this cultivating Sakshi Bhava means you are witnessing your thoughts.
yeah
योगा सूत्र में हम बताया था, भूल गए.
हमें स्किप ही हो गया, दिमाग से एकदम से स्किप हो गया ये वर्ड ही.
तो ये when you become in the state of Sakshi Bhava, then it can release the emotional pressure. Whatever stress is there, you can calm the mind. This will only happen through proper application of the yoga practices, and the person also should be like in such a dedicated way. Then only you can calm the mind. And if you are calming the mind, the prana flow will be rebalancing. Then you can balance through Nadi Shodhana, Brahmari Pranayama, like these techniques, and this will give attention to the vayus also, apana, samana, utana, vayu, and it will help in the metabolic process regain. Then it will harmonize the mind-body connection. So this is how we are applying the yogic tools. Okay, this is about Adi. Anadi, then you definitely need a medical care. So in that with that medical care, we have to add some kind of yoga practices to complement that medical care. Okay, so in the yoga therapy, we mainly focusing on the Adija Vyadi, psychosomatic. Okay, any doubt?
ये वॉइस के बारे में कुछ याद नहीं है मैम. Completely forgot this. This vayus, apana vayu, samana vayu, or
We will learn in the first week itself. We are learning. So this is about introduction to yoga therapy. First homework मैंने दिया है difference between general yoga and yoga therapy. So every day there will be homework. Okay, any doubt? Tomorrow we'll learn endocrine system.